Good day, everyone. We will be presenting a case of a 42-year-old male who works as a chef in an urban area. He consumed a home canned vegetable soup that was prepared several months ago. A few hours later, he experienced nausea, vomiting, and abdominal cramps. He dismissed these symptoms as food poisoning. The next day, the patient developed double vision, also known as diplopia, difficulty swallowing, and ptosis. His speech became slurred and he experienced generalized weakness as well. The following day, the patient was rushed to the emergency department when his symptoms worsened and the patient had difficulty breathing. The signs and symptoms of the patient led the group to identifying the disease as a case of botulism. So, what is botulism? Botulism is an infectious disease caused by toxins released by a gram-positive bacteria. It is endospore forming, named Clostridium botulinum. It causes intoxication and may result in death in relation to eating poorly preserved foods. There are three major forms of botulism, namely foodborne botulism, infant botulism, and wound botulism. What are the signs and symptoms of botulism? First, we have nausea, next, vomiting, abdominal cramps, double vision or diplopia, difficulty swallowing or dysphagia, drooping eyelids or ptosis, slurred speech, generalized weakness, and difficulty of breathing. The first reported case of botulism is not exactly in the Philippines, but a Filipino brand of a smoked mackerel. It was sold by the Asian Supermarket Group Incorporation in Albany, New York. The New York officials raised an official public warning in December 1, 2016. This smoked mackerel contained spores that cause botulism, as the smoked mackerel was said to have not been eviscerated or gutted from within. It is hard to say if there were any cases of botulism reported inside the Philippines, as it is a rare case and not usually documented or reported by hospitals or public authority. So, the three types of botulism again are foodborne botulism, infant botulism, and wound botulism. So, first we have foodborne botulism. Foodborne botulism is the most common form. In the Filipino traditional food setting, it is often associated with fermented foods such as buro and bagoong. Many occurring outbreaks come from smoked meat or fish, canned vegetables, and processed cheese. Second, we have infant botulism. In infant botulism, the bacteria grows inside the baby's gastrointestinal tract. Raw honey and contaminated food and soil has been implicated in some reported cases. It may result in flaccid paralysis in babies, or most commonly known as floppy baby syndrome. Lastly, we have the wound botulism. In wound botulism, the endospores would enter through a parenteral site like tetanus, except the symptoms are much similar to foodborne botulism. Cases of wound botulism have surged in the past several years due to the increasing population of intravenous drug use. The Department of Health, or DOH, in the Philippines has a system established to monitor any possible cases of botulism in any part of the country. The DOH has a direct line to the Centers for Disease Control and Prevention and the World Health Organization as both health authorities to have a close eye on the disease. As per outbreak investigations, even if botulism in the Philippines is a rare occurrence, the process of investigation still includes 1. Pinpointing the source of contamination, 2. Listing the affected products, and 3. Spreading awareness to the public about safe food handling and disposal. It may be challenging to directly diagnose botulism due to its rarity and at the same time, its similarities of symptoms to other diseases of the nervous system. Here are some diseases or syndromes that are similar to botulism. Number 1, we have Guillain-Barré syndrome, where there is symmetrical muscle weakness that ascends from the lower limbs. So the symptoms includes facial weakness, areflexia, ascending paralysis, and autonomic dysfunction. The cerebrospinal fluid analysis often shows elevated protein with its cell count within normal limits. And second one, we have myasthenia gravis, where its symptoms gets worse with physical activity and eventually resolves or improves with rest. Acetylcholine are receptor antibodies that are often present in blood. Tensilon tests can be diagnostic for this disease. The symptoms include ptosis, diplopia, difficulty swallowing, and fluctuating muscle weakness. Lastly, we have tick paralysis. Any patient diagnosed with tick paralysis immediately has their conditions improve after the removal of the tick. It is common in areas where exposure to ticks is likely, or in some cases, if the patient is in direct contact with pet animals like dogs, as they can be a transport of host to the ticks if infected. The symptoms include absence of fever, ataxia, and ascending paralysis.
From the differentials, the infection or disease or syndrome similar to botulism are Guillain-Barré syndrome, myasthenia gravis, and tick paralysis. We have two diagnosis tools or procedures to identify botulism. These are mouse bioassay and culture obtained from the patient. Seeing that this is botulism, the medical practitioners may request or use a stool sample. The signs and symptoms, patient's profile, including medical history and the confirmation from the laboratory or testing, is the basis of clinical impression for botulism. There are also no imaging techniques for this specific case. As per the immunogenic testing, enzyme-linked immunosorbent assay or ELISA can be used to detect antibodies against botulinum toxin in a patient's serum. It can also be used to detect the presence of the toxin itself. Polymerase chain reaction or PCR can also be used to detect the presence of Clostridium botulinum DNA in a sample, indicating the potential presence of botulinum toxin. Mass spectrometry is a method used to identify the specific molecular structure of the botulinum toxin, providing precise identification. And lastly, the rapid affinity immunochromatography is a rapid test for sensitive detection of Clostridium botulinum neurotoxin types A, B, E, and F. Next, for the gold standard diagnosis, mouse bioassay can be used to detect toxin activity, and culture of feces or from the said home canned vegetable soup may also be used.
Botulinum toxin can form in improperly canned or cooked foods, particularly low-acid canned goods like vegetables. If they are not processed correctly, this allows the bacteria to survive and produce toxin. Next is ingestion of unpasteurized honey. While rare, honey can contain Clostridium botulinum spores. Infants are particularly vulnerable because their digestive systems may not be able to prevent spore growth and toxin production, leading to infant botulism. The gold standard treatments for botulism management involve antitoxins administered via intravenous site. These are essential for neutralizing botulinum toxins circulating in the bloodstream, helping to halt the progression of botulism symptoms. Next is penicillin. While not directly targeting the toxin, penicillin can be used to treat infections caused by Clostridium botulinum bacteria, particularly in wound botulism cases. Next is gastric lavage. This procedure involves flushing the stomach with fluid to remove any remaining ingested toxins, but its use is limited and may not significantly alter the course of botulism treatment. In the Philippines, botulism cases are infrequent, leading to sparse documentation and public reporting of statistics. To access information about the disease prevalence and incidence in the country, individuals typically rely on health departments and authorities for official data and updates. Botulism is characterized by low prevalence and incidence rates globally, including in the Philippines. Despite its potential wide distribution, cases are rare in the country. The disease tends to be more common in regions with inadequate sanitation and improper food handling practices, emphasizing the importance of hygiene and safe food preparation to prevent its occurrence. In terms of mortality and morbidity reports, botulism, though rare in the Philippines, can lead to significant mortality and morbidity if left untreated. When it comes to level of interventions, in primordial intervention, use sterilized canning containers and process food at appropriate temperatures and pressures. For low-acid veggies, meat, and poultry, use a pressure canner with temperatures ranging from 240 to 250 degrees Celsius. Pasteurize or boil foods for more than 20 minutes to ensure safety. Store canned foods in a clean, cool, dark, dry place below 95 degrees Fahrenheit. Stay informed about expiration dates and adhere to canning guidelines. In terms of primary prevention, check expiration dates and inspect food for abnormalities before consumption. Examine containers for dents, cracks, or bulging lids. Follow a first in, first out policy for consuming stored foods. Store open canned goods tightly in glass or plastic containers in the refrigerator, with specific guidelines for different types of foods. In secondary prevention, recommend stool examinations for suspected cases of botulism. Administer antitoxin promptly to prevent further toxin effects. And in tertiary prevention, schedule follow-up appointments to monitor and manage lingering symptoms. Provide nutritional support to aid recovery and maintain general health. Offer respiratory care to prevent complications like pneumonia, potentially necessitating mechanical respiratory support. These interventions highlight comprehensive strategies from prevention through treatment and recovery to manage botulism effectively and reduce its impact on affected individuals.